Chapter 24, Personal and Professional Development for Sterile Processing. We have arrived at the final chapter of this technical manual. Throughout our journey, we have mastered the technical intricacies of cleaning, sterilization, microbiology, and instrumentation. Today, we are shifting our focus. We are moving beyond the technical skills of daily operations to focus on you, the technician, and your future. The primary objective of this chapter is to guide you on how to transition from simply having a job to building a robust and rewarding career. Let us begin with the introduction. For a long time, sterile processing was viewed merely as an entry-level job, often seen as a stepping stone to other departments. However, that mindset is outdated and no longer reflects reality. Today, sterile processing is recognized as a skilled profession with a clear and structured career pathway. As healthcare technology advances, introducing robotic surgery and complex endoscopes, the demand for highly educated and certified technicians continues to grow. You are entering a profession that is widely considered the heart of the hospital. This is not just a poetic metaphor, it is a functional reality. Just as the heart pumps life-sustaining blood to the body, your department pumps life-saving instruments to the operating room. Your commitment to professional development ensures that this heart keeps beating strong. Your personal growth directly translates to safer surgeries and better outcomes for patients. Remember this core truth: an educated technician is a safer technician. Now, we must distinguish between two critical concepts found in your workbook: personal development and professional development. While they sound similar, they serve different functions in your life. First, let us look at personal development. These are activities that improve your self-awareness, help you develop your identity and potential, and essentially enhance your quality of life. Examples of this might include learning stress management techniques, improving your listening skills, or engaging in health and wellness activities. While these activities benefit you personally, they also make you a better teammate. A technician who manages stress well is calmer during a busy shift. Second, we have professional development. This is the acquisition of specific skills and knowledge for the express purpose of career advancement. Examples here are very concrete. They include passing your CRCST, Certified Registered Central Service Technician, exam, attending a medical conference to learn about new regulations, or learning to operate a new instrument tracking system. The workbook introduces a vital concept here called lifelong learning. Because the healthcare field changes so rapidly, if you stop learning, you immediately start falling behind. Therefore, strictly speaking, lifelong learning is a requirement for a sterile processing professional, not just an option. It is the fuel that keeps your career moving forward. Having established the necessity of lifelong learning, we now move to the specific types of professional development available to you. The most critical credential in our field is certification. Gaining certification, such as the CRCST, is the primary credential in our industry. It is the most significant step you can take to validate your competency. It proves to the public, to your employers, and most importantly to your patients, that you have met a predetermined national standard of knowledge. It transforms you from a worker into a certified professional. However, obtaining the certification is only the beginning. Once you are certified, you must maintain it. The Healthcare Sterile Processing Association, known as HSPA, has strict requirements for renewal to ensure your knowledge stays current. You are required to accumulate 12 continuing education units, or CEUs, per year to renew your certification. Generally speaking, one CEU equals approximately 1 contact hour of education. It is vital that you understand the lapsing policy, as this is a critical quiz point in your workbook. It is your personal responsibility, not your managers and not the educators, to track your CEUs and submit them before the deadline. If you fail to renew your certification on time, you typically enter a suspension period. This is a dangerous zone. If you do not resolve the issue within the allotted time during this suspension, you will lose your certification completely. There is no administrative fix for this error. To regain your status, you would have to retake the entire exam. There are no shortcuts here, so managing your continuing education credits is as important as managing the sterilization cycles themselves. Apart from formal certification, we also have conferences and in-services. Attending local or national chapter meetings and conferences is an excellent way to network with peers and learn about emerging technologies. On a more frequent basis, we have in-services. These are short training sessions provided by your employer or vendor representatives directly during work hours at your facility. These sessions are crucial for keeping staff updated on new instruments, revised policies, or specific instructions for use, IFU. They ensure that your daily practice aligns with the most current manufacturer's instructions and safety protocols. Now that we understand the importance of development and the certification requirements, let us look at where this profession can take you. We often refer to progression in this field as the career ladder. The definition of a career ladder is a structured sequence of job positions through which a person progresses in an organization. In sterile processing, this ladder typically follows a specific 5-step progression. Understanding these steps helps you visualize your future. Step 1 is the sterile processing technician, often called Level 1. This is the entry-level role where you focus entirely on learning the basics. Your primary responsibility is mastering cleaning, decontamination, assembly, and sterilization. At this stage, you are building the technical foundation that will support your entire career. Step 2 is the Certified SP Technician, or Level 2. At this stage, the technician has passed their certification exam, such as the CRCST. They are proficient in all areas of the department and have demonstrated a higher level of commitment. Because of their proven knowledge, Level 2 technicians are often trusted to precept, or train, new staff members, passing on their habits and skills to the next generation. Step 3 involves leadership, specifically the lead technician or shift supervisor. This role is a pivot point. The lead technician is responsible for directing the workflow of a specific shift or area. They are the ones prioritizing instrument trays based on the surgical schedule and solving daily operational problems as they arise. They bridge the gap between management and the floor staff. Step 4 moves into high-level administration as the manager or director. This role shifts focus away from daily tray assembly to the strategic oversight of the department. They are responsible for budgets, hiring decisions, creating policies, and ensuring regulatory compliance across the board. Finally, Step 5 is the educator. This person is dedicated entirely to training staff and managing competencies to ensure everyone follows the standards. It is a critical role for quality assurance. A vital insight from your workbook to remember is that advancing to these higher levels requires more than just technical skills. It requires leadership and administrative skills, such as computer proficiency and budgeting. You cannot simply be a good cleaner to be a good manager, you must develop a new set of professional tools. To climb this career ladder effectively, you need a plan. This brings us to the essential skill of planning career goals. There is a profound difference between a wish and a goal. Saying, "I want to do better," or "I want to be promoted" is not a goal. It is merely a wish. To achieve true career advancement, technicians must set specific targets using the SMART method. SMART is an acronym used to create goals that are actually reachable. Let us break down each letter, as this is a critical concept for both your life and your exam. S stands for specific. You must define exactly what you want to accomplish. Do not just say, "I want to learn more." That is too vague. Instead, say, "I will pass the CRCST exam." M stands for measurable. You must establish criteria to track your progress. For example, "I will study 1 chapter per week." This gives you a metric to know if you are on track or falling behind. A stands for attainable, sometimes called achievable. The goal should be challenging, but it must be possible with your current effort and abilities. Setting a goal to become a director in 2 months is not attainable and will only lead to frustration. R stands for realistic or relevant. The goal must matter to your career and be realistic given your current resources and available time. Finally, T stands for timely. The goal must have a deadline. A goal without a deadline is just a dream that you can postpone forever. An example would be adding the phrase, by December 31st, to your goal. So, when we put it all together, a complete SMART goal sounds like this. I will study 1 chapter per week to pass the CRCST exam by December 31st. To achieve these ambitious goals, you cannot do it alone. You need resources. First, you have professional associations like HSPA, Healthcare Sterile Processing Association, and AORN, Association of Perioperative Registered Nurses, and standards organizations like AAMI, OSHA, and the CDC, which define the rules we play by. But perhaps most personally impactful are mentors. A mentor is an experienced and trusted advisor who provides counsel and guidance. It is important to note that a mentor is not necessarily your direct supervisor. In fact, it is often better if they are not. A good mentor helps you navigate office politics, identify career goals, and improve your skills in a safe environment where you can ask questions freely. Related to mentoring is networking. Networking is defined as developing professional contacts to exchange information and advice. You can do this by attending HSPA chapter meetings or volunteering. This is crucial because many job openings are filled through word-of-mouth recommendations within a professional network before they are ever publicly posted on a job board. Additionally, maintaining a professional presence on platforms like LinkedIn is increasingly important for your career visibility. Now that you have your goals set and your network established, you need the tangible tools to secure the position. This brings us to Section 7, which focuses on professional development activities, specifically the resume and the interview process. Let us start with the resume. The definition of a resume is a summary of a person's education, experience, and professional skills used to apply for a job. Its primary purpose is simple but often misunderstood. A resume is a marketing tool designed to get you an interview. It is your first impression. Often accompanying the resume is a cover letter, which is your chance to introduce your personality and specific interest in the role before the employer even looks at your skills. When developing your resume, format matters. Most employers prefer a chronological resume. This format lists your jobs in reverse order, starting with the most recent one and working backward. Regarding content, you should focus on skills and achievements rather than just listing generic duties. For example, instead of simply writing "I cleaned trays," which anyone can do, write "maintained a 99% accuracy rate in tray assembly." This quantifies your value and shows the employer exactly what you bring to the table. There is a critical workbook tip here that acts as a severe warning. You must proofread your resume. A resume with typos suggests you lack attention to detail. In sterile processing, a lack of attention to detail is fatal. If you cannot spot a typo on a one-page document, a hiring manager will immediately worry that you cannot spot bioburden on a surgical instrument. Furthermore, accuracy is a legal requirement. Falsifying information on a resume is grounds for immediate termination or even the revocation of your certification. Once your resume gets your foot in the door, you face the interview process. Preparation is key. Research the hospital before the interview so you know their mission statement. On the day of the interview, adhere to strict punctuality. Arriving late to an interview is often an automatic disqualification. It demonstrates a lack of respect for the interviewer's time and suggests poor reliability. You should plan to arrive 10 to 15 minutes early. Dress professionally. Business attire is safer, though business casual or clean scrubs may be acceptable if specifically requested. Also, be mindful of your body language. Non-verbal cues like eye contact and posture speak as loudly as your words. During the interview, you will encounter different types of questions. First, there are closed-ended questions. These elicit a simple yes or no answer. An example is, do you have experience with steam sterilization? Second, there are open-ended questions. These require a longer explanation or a story. An example is, tell me about a time you made a mistake and how you fixed it. This leads us to the most common interview style used in healthcare today, known as behavioral interviewing. Employers use this because they believe past behavior predicts future performance. They will ask questions starting with phrases like, tell me about a time when. To answer these effectively, use the STAR method. STAR stands for situation, task, action, and result. You describe the situation you were in, the task you needed to perform, the specific action you took to resolve it, and the positive result that followed. This structure ensures your answers are complete and impressive. After the interview, it is a professional standard to send a brief thank you note or email within 24 to 48 hours. This simple gesture reinforces your interest in the position and demonstrates your professionalism. We must also discuss advanced employment skills, specifically regarding interview nuances and what we call the red flag rule. During an interview, you must never speak negatively about past employers or supervisors. This is an absolute rule. Even if your previous boss was difficult or the environment was toxic, you must frame your reason for leaving as seeking new challenges or pursuing growth opportunities. Workbook logic dictates that bad-mouthing a previous employer implies that you have a bad attitude or are difficult to manage. Remember, displaying a positive attitude and a willingness to learn is often more important to a hiring manager than technical perfection. A manager can teach you how to wrap a tray, but they cannot teach you how to be a positive person. Finally, regarding employment, let us discuss leaving a job properly, known as resignation. The professional standard is mandatory. If you are leaving a job, you must always provide a written 2-week notice. Leaving without notice burns bridges. In the tight-knit healthcare community, this may prevent future employment not just at that specific hospital, but within that entire healthcare system. Your reputation is your most valuable asset. Protect it by leaving with grace. Once you have secured the job and established yourself, you will naturally look toward advancement. This brings us to Section 8, Promotions. The golden rule of advancement in sterile processing is simple: promotion is earned, not given. Managers look at specific factors when deciding who to promote, and you should focus on these 4 pillars. First is reliability, which primarily means attendance. In a department that runs 24 hours a day, 7 days a week, being someone who shows up on time every day is invaluable. If you are not there, you cannot lead. Second is technical competence. You must be excellent at the core job before you can lead others. You cannot supervise decontamination if you do not know how to clean a lumen. Third is attitude. A positive, solution-oriented attitude is often the tiebreaker between 2 equally skilled technicians. Leaders are people who solve problems, not people who just complain about them. Fourth is certification status. As we discussed earlier, you usually cannot move into leadership roles without your CRCST and often secondary certifications. These include the CIS, Certified Instrument Specialist, CER, Certified Endoscope Reprocessor, or CHL, Certified Healthcare Leader. These credentials prove you have the advanced knowledge required to manage complex situations and specific instrument challenges. To navigate this promotion path effectively, you cannot simply hope for the best. You need a structured timeline. Section 9 suggests creating personal and professional development timelines. A practical approach is to draft a 1-year, 3-year, and 5-year plan. For example, your 1-year plan should focus on the immediate basics, such as gaining your experience hours and passing the CRCST exam. Your 3-year plan might target a leadership role, such as becoming a lead technician or shift supervisor, and perhaps obtaining a secondary certification like the CIS for instrumentation. Your 5-year plan could aim higher, looking toward a manager role or department director position. This long-term planning brings us to Section 10, Formal Education. While a high school diploma or GED is the minimum entry requirement for most technician roles, the industry is shifting. Many leadership roles now prefer or even require an associate or bachelor degree. These degrees are typically in fields such as healthcare administration, business management, or biological sciences. As departments become more complex with multi-million-dollar budgets and strict regulatory requirements, hospitals need leaders who have the academic background to manage these business aspects. Pursuing formal education demonstrates a deep commitment to the profession and opens doors to upper management that experience alone might not unlock. Before we conclude, we must touch on the nature of the industry discussed in Section 12. Sterile processing is a dynamic, fast-paced field. Technologies, like robotic surgery systems, and standards, such as AAMI updates, change frequently. Therefore, a key characteristic of a successful technician is adaptability. This is the ability to adapt to change without resistance. The most dangerous mindset in our field is the phrase, "We have always done it this way." That mindset leads to errors, safety violations, and stagnation. In a field where patient safety is on the line, we must be willing to evolve and improve our practices every single day. This brings us to the conclusion of our journey. You are entering a profession that is widely recognized as the heart of the hospital. This is a powerful and accurate analogy. If the heart stops, the body dies. If sterile processing fails, surgery stops. By committing yourself to professional development, you ensure that this heart keeps beating strong. Your personal growth directly translates to safer surgeries, reduced infection rates, and better outcomes for every patient who enters your facility. Finally, let us review the key sterile processing terms for this chapter one last time. These are high-probability definitions for your final exam, so please listen closely. 1. Career ladder, a structured sequence of job positions through which a person progresses in an organization. 2. Certification, association recognition attesting that an individual has met a predetermined standard, such as the CRCST credential. 3. Competency, a standard of knowledge, skills, and abilities required for successful job performance. 4. Mentor, an experienced and trusted advisor who provides counsel and guidance. 5. Networking, developing professional contacts to exchange information and advice. 6. Resume, a summary of a person's education, experience, and professional skills used to apply for a job. 7. Continuing Education Unit, CEU, a credit granted for participation in an approved educational program, where 1 CEU typically equals 1 contact hour. This concludes the audio lecture for Chapter 24, Personal and Professional Development. You have now completed the entire technical manual. You are equipped with the technical knowledge to clean, disinfect, and sterilize, and the professional wisdom to build a thriving, lifelong career. Good luck on your exam, and welcome to the profession.